Sorry.
You have to be really close. Can you hear me now?
Yes.
What's that?
We're working on it. We're trying to get microphones. Let's just try and be quiet so that we can hear. They are working on it, but let's thank you, they're working on it, but let's all try and be as quiet so we can hear the message that Northern Health is going to deliver. Thank you. All right, thanks very much for the residents coming to show up here. Also to Northern Health for coming in to dialogue with our residents on the changes that they announced on Thursday. Again, I mentioned it outside. Maybe everybody was not outside. Again, let's be respectful. Let's show our true Tumblr residents and stuff like that. We don't need yelling. We don't need the foul language. We have children present. We don't need any aggressiveness here. The only way to hear from Northern Health what's going on and why they're doing this is to let them speak. I know, again, I'll make it known that they know I don't support it right now. I don't think we can close our ER, but we also have to allow them to explain why. So I know, we've had many hot topics in Tumblr Ridge, and it's always been respectful. So that's all I'm asking the residents here to do is be respectful. Get your questions asked and answered. So again, we are working right now trying to find mics and stuff to make it easier. So if everybody can if we can all be quiet, everybody will hear what they have to say, and then we'll hear questions from all of our residents. I did ask Northern Health if I was allowed to have somebody speak before we allowed Northern Health to present, and I've invited Dr. Charles Helm.
So thank you, Your Worship, and I echo what you say about welcoming Northern Health here. I do want to give some context, and that this is not the first time that I've been in this situation. I've been here for 33 years now, and people like Barb, Patsy, Gail Newman, Sharisa, what we can call the old guard, we know we have been through this before. Northern Health has tried to shut down after hours emergency services in the past. We've always managed to push back, and I really hope that we can manage to push back again. But I want to really thank Mayor and Council for the leadership they've shown. The strongly worded statement, but I think it was an appropriate statement to make. I'm very grateful to have this Mayor and Council in office right now. So unfortunately, what it seems, we have something of an adversarial situation, whereas I like collaborating, not being in a situation like this. And so I really want to say to our Northern Health representatives here today, can we be collaborative? I was blindsided on this. I heard about it on Thursday at noon. Our mayor was blindsided by this. So there are things that have happened that are not good. We need to acknowledge that, but we also need to try and rise above that and try to be constructive. We don't want to be secretive. We want to be open with our agenda. We don't want hidden agendas here. And what I would like everyone to know, and what puzzles me, is that this announcement was simply made without consulting the many, many friends that Northern Health has, who are trying really, really hard to address the situation we have here, which is a crisis situation, make no mistake. I am the co-chair of the South Peace Division of Family Practice. I was not informed about this. Our Division of Family Practice has got funding from the Peace River Regional District, who is another ally, to do recruitment, to deal with situations just like this. We're actually using those funds from the Peace River Regional District to go to Ireland and England in November, specifically to job fairs, to recruit for places like Tumblr Ridge, not just Tumblr Ridge, but Chetwynd and Dawson Creek, which also have problems. That's how we're spending our funds. That's called innovation. That's what we're trying to do. I'm also the co-chair of the Primary Care Network with Kendra Kiss from Northern Health. Something like 21 net new positions have been created by the government for the South Peace. Many, and if not most, of those are doctors who could work in a place like Tumblr Ridge. We're just beginning posting those positions, and please wish us luck in getting that. The other thing, we have things like real-time virtual support. This is using technology to provide virtual care, including in the emergency room. It's been done in Dawson Creek to prevent Dawson Creek going on diversion. These are the sort of things, these are all my buddies that put this on in Rural Coordination Center of BC. Why was I not approached? Why was I not asked to speak with them and see what could be done? And then there's the hybrid care model. We have federal funding, and we have very competent doctors and colleagues within northern BC who are putting forward Tumbler Ridge as a pilot project to make hybrid care work. And that could either be in the clinic or it could be in the emergency room, could be either. But either way, it's going to add 1.0 FTE to our complement of physicians. I'm working with them. The moment I heard about this, I said, this is amazing. Let's jump on this. Let's see how it can help us. They tell me they have not had a response from Northern Health despite many requests. Northern Health needs to respond to things like this, because otherwise we have to ask, what is the agenda? The other thing I can think of is that across northern BC, there are very remote nursing stations that have nurses, no doctors, they just have nurses, often working 1 and 2, alternating call, but they provide 24/7 coverage. I'm thinking, for example, of Tackler Landing, where a friend of mine was working. How come those communities can have 24/7 after-hours availability for their emergencies, and a place of 2,500 people cannot? It doesn't make sense to me. The other thing I can tell you is that every year we put on the Tumbler Ridge Medical Conference. This year we had a record number of physicians and allied health professionals attending, 92 to be precise. It was an incredible success. People came to me afterwards and they said, you have done more in a weekend than Northern Health has done in a decade for recruitment. This is not a competition. But I will tell you that there was no one from Northern Health there. Despite many invitations, there was nobody from senior Northern Health management present. So to me, it's sometimes as if we're working in parallel universes and we're not communicating. And I say we need to collaborate. I'm a collaborator. We need to communicate. We don't want to blindside each other with things like this. The other problem is, once an announcement like this goes out, it's incredibly hard to get back what has been taken away. We have suffered death by 1,000 cuts in Tumbler Ridge over the last 30 years. Little thing, little thing, little thing. Now this one is a big one, make no mistake. This is the big one. And if we lose this battle, we've lost our community, to put it bluntly. I look around here and I see people who are alive and with us today because of the way we operated our emergency room in the past. I also know, not just the people who are here, but their family members as well. And I look around, and this is the terrible thing. I think of, if we lose our emergency room care after hours and on weekends, which of us will not make it? Because people will die because of this. We talk about the golden hour, so I don't care about statistics that might be shoved in my face. I know we have a community of 2,500 people where the roads are mountain roads. We have a long winter. Sometimes it's impossible to get out. People will die. So, the other thing is, as things stand at the moment, with weekday hours of, 8 till 7, and nothing on weekends, how do you think at the division level, where we are trying so hard to recruit, we're going to go to Ireland and the UK, do you think I can sell it to people when I say to them, you're going to work 8 to 5, 8 to 7? You can't service your community as you want to? The way I fought back against Northern Health every other time this happened was to say, I'm a family doctor, I want to serve Tumbler Ridge in its entirety, not just from 8 to 5. And that's the same thing I expect from our physicians. So I don't want to spend too much time talking, but I do want to ask a question that I think we need to hear from the Northern Health contingent today, and that is, we understand you've got a crisis. You're facing a crisis. We understand you need to try and do something. We understand you cannot make doctors materialize overnight. Although, just by the way, I know of a doctor who would move here within a week or two. That would change things, I hope. But what I want is the assurance from Northern Health that when those numbers come back, our emergency room after hours care comes back with it. Otherwise, we are lost. So what I'm asking is for that announcement that went out that said nothing about this is temporary. It said nothing like that. It simply said, this is what's happening. In other words, it could be forever. If I get told that this is temporary and as soon as the numbers come back, we're back to business as usual, that's when I can recruit doctors elsewhere to come to Tumbler Ridge. Without that, I'm wasting my time. So the question is, what will it take to bring our health services and our emergency after our services back to Tumbler Ridge? And I hope you guys can answer that for me, please. I think that announcement, there needs to be an acknowledgement that maybe it was hasty, whatever, but there needs to be an addition that this is temporary and that when the numbers come back, the healthcare comes back. That is the very least that we need in Tumbler Ridge. Thank you.
My name is Lisa Zietzenada. I'm the Vice President of Clinical Operations, who's responsible for hospital and community programs in Northern Health, which includes your community, your hospital. I'm joined by Angela DeSmit, who is our Vice President, Professional Practice and Allied Health Practice, and Chief Nursing Officer. And you have to introduce yourself, Celia. No, you can't reach. Okay, so I'll do it then. And Celia Evans, who is, and I always get your title wrong.
So I'm Celia Evanson, and I'm the Medical Director for the South Piece.
So she is responsible for the physicians in the South Piece, which is what, in some respects, is bringing us here today. So I want to start with, before I start the presentation, by first apologizing that a notification went out before we were here having a community meeting. The intention was to meet with the community first, have conversations, understand concerns before that announcement went out. The challenge is the physicians had already stopped providing night coverage, and that announcement had to go out because we wanted to make sure that people understood to call 911. It was addressed earlier that it didn't say if it was permanent or temporary. And I feel like that's kind of the big question in the room. Healthcare is not static, it is changing. If we are in a different situation, would we be having a different conversation in the future? Very possibly so. That announcement talks about now. That is right now what our situation is. What it will look like in the future will depend on our recruitment efforts, will depend on the models of care, additional supports available. And it's a conversation that we should be having moving forward. So what's changing and what's staying the same? So as of yesterday, weekday ED services 9 to 5 will continue to be our weekday ED daytime services of 9 to 5. What's changing is the after hours on-call for nursing and physician coverage. The on-call will be for an hour before the clinic opens and for 2 hours after the clinic closes. 911, that's not changing. Anytime there is a significant medical need, you should call 911. And I'm going to talk a little bit about that when we talk about transport, because I think that's something that has come up often in this town. When people go to the health center and then you wait to be transported for an excessively long period of time. I'm going to address that with you. And primary care clinic will remain open from 8:30 to 5:30. So it is that on-call overnight weekends that is changing right now. Our goal is to make sure that daytime services are sustained. We are in an extreme health and human resource challenge. This is no different in Tumbler Ridge than it is in Hudson Hope, than it is in Dawson Creek, than it is in Interior, Vancouver Coastal, Fraser, the island. I know that you've looked at the news. These stories are in the news across BC, across the country, and honestly across North America, where I will say we are doing very proactive campaigns for recruiting, given the polarization in the States. And have been successful in some cases to recruit. So supporting the change. BCEHS is putting an additional ambulance in Tumbler Ridge and an additional ambulance in Dawson Creek. The Dawson Creek paramedics will be advanced care paramedics, which have a wider scope than our paramedics that we have in other areas. And it's the first time that this is being put into place in the East. The goal is faster response time and turnaround to appropriate care. So I've heard stories from people in community that they go to the health center at night and they'll wait hours to be transported to Dawson Creek. That's because when you're already presented to a hospital, you're being moved by the patient transport network. It's interfacility transfer, facility to facility. And they look at higher acuity patients. You are triaged as either a red or a yellow, and then they take available resources and move people. When you call 911, you do not go through interfacility transfer. The goal is transfer to the most appropriate level of care for the presenting concern of the client that's in front of the paramedics. Our goal is that we can recruit physicians, and we're going to be talking about physician recruitment. There are open positions that are already posted. There are 2 posted. So I would invite your resident physician, who almost seems like a father of the community in some ways, but certainly a father of healthcare in Tumbler Ridge. That's been mentioned quite a bit. And if there are people who want to apply tomorrow, there are open positions for them to apply to. We are not discouraging recruitment. In fact, we're doing just the opposite. We are trying to get people to come here. So the impact. So you can read the stats behind me. The reality is 90% of the people who present at night to the ED are not emergency level patients. They're people who could be seen in clinic, but they're attending outside of office hours. So the ask would be for that group of people, and there's not very many, to come during the operating hours. The people who are presenting that do require a higher level of care, who have chest pain, who have shortness of breath, difficulty breathing, we want them to be treated in a facility where we have the laboratory services, the surgical services, the diagnostic services to be able to support the care of that person. all of those people would have come here and then been transferred through interfacility transfer. That can delay access to going to a hospital that actually does do that care. Now, there are some things that can be done when the ambulance comes here. They can initiate support for the patient en route. So you're not waiting to get to the next hospital before when you have a critical event that you're being cared for. You're being cared for in that ambulance. In the event that it is a critical life-limiting concern, we're working with BCEHS to send the ACP, the advanced care paramedics, to meet clients halfway so that we can do even more in the ambulance while we get the patient to Dawson Creek. So what is not happening? And I want to be really clear on this, and so clear that I'm going to make an offer to a couple people. There is zero funding decrease out of Tumbler Ridge. Your budget is your budget. I can say that 100% because I am responsible for your budget. There will be not 1 cent, I guess it's 5 cents now, removed from your budget at all. I am happy to ask the mayor, perhaps a designate from his council, and a couple community members who have interest. I am happy to open that up to you so that you can see what the budget is and ensure and hold me accountable that I am not moving a penny from your budget. This is not about budget. It's about human resources. Money is not the issue here. So I don't want people to think they're just going to claw back the budget and it'll never exist again. That is not what's happening. Not one person will be laid off. Of course not, because I need more people. So, well, we actually do have people. Your nursing positions are
I
filled.
lost my doctor, and she's probably the doctor to most everybody in this room.
Yeah, and she's
There's
gone,
nobody.
and there's no replacement.
So she's not laid off.
No, she's leaving.
But there's no
She
replacement.
left, like they all did.
Because of Northern Health, they're leaving.
So I will pass the microphone over when we talk about physician-related issues. So the benefit we're hoping to get is that the people who can be seen during the day are coming in and being seen during the day. We are working to ensure that the providers that we have are able to see everyone in that daytime period. We've increased the transportation. There's an additional car in Tumbler Ridge, so there are 2 ambulances here. And the goal of that, if both ambulances are out of town, because I know I'll be asked this question, what if both of them leave? If both of them leave, then EHS will have to move fleets around. They do this every day. But we have 2 additional cars now in the east that we didn't have before. Our goal is to retain our physician and nursing and allied staff. We've heard countless times, I can only speak from the nursing perspective, and Angela will provide additional information. We've done exit interviews with everyone leaving, both physicians as well as staff. And the call has been framed as being one of the detriments because they can work in other communities this size that do not have this model, where they do not have to be on call. And then when they're on call, they have to have X number of hours between coming in on call and then going back to work. And then we wind up closing during the day, which is when the majority of people are presenting. And the staff feel extreme moral distress.
What about taking our staff and sending them to other communities? Happens all the time. My neighbors and theirs goes to work in Chetwood,
Yeah.
Port St. John, all over.
We don't send our nurses places. Nurses have free will and freedom of choice. And I would ask you to just let me get through this and then please get in a line for questions. Nurses have free will and can pick up wherever they want. They don't give up their shifts here. They can't, according to contract, but they can pick up shifts in any other community that they're registered in. That is the end of the presentation. I told you it was going to be very quick. And so we will have people coming up, and then if you guys can move closer, I'll hand the mic or answer it myself if it's in my domain.
I'm relatively new to Tumbler Ridge. I thank you for coming today, and I thank you all for coming to show your support. I'm listening to Dr. Helm, and there's one thing I want you to promise me when you leave. I want you to coordinate with Dr. Helm in searching and recruiting physicians. I do not understand why Northern Health feels they have to feel themselves separate from Dr. Helm and his organization. So I would like for you to please promise me that you will coordinate with him.
So unfortunately, Dr. Helm and I, so as the medical director for the South Piece, I am responsible for physician recruitment, but I have not been invited to the South Piece Division's table, and I have not always been informed of what they're doing. So I would be happy to promise to coordinate with Dr. Helm and the South Piece Division. And I would hope that if he has a doctor who wants to apply, that we have 2 postings up and they're ready anytime.
Thank you so very much. Another thing that I have noticed coming here, it used to be that if a person wants to see a doctor, there were plenty of time and everybody was able to see a doctor. Now, it seems like nobody has time to be able to see a doctor. It's like we have to wait forever to get an appointment.
4 to 6
And
weeks.
yes, yes. And I do not feel this is fair to the patients, to the people, and probably not fair to the physicians either. Something has changed, and I would like to know what.
Thank you for the question. So firstly, I would just like to say that we're basically down to 50% of the physician recruitment that we require. So it's difficult to be on call 24 hours a day, provide 24/7, and have reasonable access to the clinic the other day. I am sure that there are ways that we can look at how we can improve this, but that's not really my my bailiwick. But just kind of saying that, what I've heard from the physicians is that they're tired and they can't do 24/7 call as well as be available for their patients. And it is morally distressing for them as well. You can't take 50% of your human resources of physicians and expect them to do 100% of the work.
And if there are things we can do in the clinic from a scheduling perspective, I'll commit to work with the local team to look at the schedules. So that part is mine, and I will make sure that we look at that, because if we're placing any barriers in it, we need to remove them, and my team is in the audience as well, and we commit to looking at that.
One more question, because we have other people to ask questions. I want to say thank you, but one thing that I think is very important is there are times when we cannot travel because the roads are so severe, and perhaps your advanced care team cannot meet an ambulance partway to Dawson Creek. That is why we need an emergency unit here in Tumbler Ridge. Thank you.
I actually have more than one question. Sorry. My first question is actually in regards to what you were saying about BCHS adding 2 more cars, and I think that's great. We actually do need more cars. However, I don't know, there's been a few news articles now about the struggles that BCHS has had to recruit those people to staff those cars. How are these cars going to get staffed? How are they going to be able to run full time so that there actually is coverage in town if the other ambulance is doing a transfer. That's my first question, because that's now like, that's a big one.
For sure, and that's a great question, and you're right. Going back about 2 years, EHS was having trouble staffing their cars. They've put on a number of educational sessions. They've worked to get additional seats and educational seats available. They've turned around and turned out record numbers of paramedics. They increased the ACP, the Advanced Care Paramedic, and the CCP, Critical Care Paramedic training as well. I will not stop advocating. I know we got an ACP. I will not stop advocating for a CCP and other supports as they become available. So that is something that we will continue to work with EHS, and we are working with them through this to ensure that while we're going through these staffing challenges, that we will have the supports we need to bring people to higher levels of care that need to go.
Okay, my second big question here is, there is obviously an issue with recruitment. We can't squeeze a doctor out of a rock. I understand that. However, it is your guys' responsibility as the health authority to ensure that the staff is here. It is not our concern. It should not be our problem whether or not you guys have retention problems. There should still be a physician here. That is your responsibility, even if it's temporary, even if it's a hybrid, whatever, there should still be coverage. Is there any plan, Is there any plan to bring scholarship and bursaries, actual scholarships and bursaries that pay for the travel and expenses that require to get to the health centers to get the training for people in town to be able to apply to these positions? I know it's not necessarily feasible for MDs, but there are certainly people in this town with the attitude and intelligence to be nurses. Is there anything you guys are doing to help recruitment?
Can I get that to Angela, because she'll be able to answer that.
So thanks for the question. So Northern Health has been working with our post-secondary schools in terms of one of the issues was that most of their health sciences programs, including nursing, weren't 100% full. And so we've been working with Northern Lights College and Dawson Creek, the new program in Fort St. John for the nursing degree program, as well as Prince George and Coast Mountain in the Northwest. By doing advertising, offering additional placements so that once they come and they see what the work is in the north, that they're more apt to come work here. We hire 143 employed student nurses every summer, and they get 145 hours, and that really helps to consolidate their wanting to come back to the Northeast and work with us. And we work with the schools. I know the Peace River Regional District has scholarships for healthcare to get more nurses in. Northern Health is part of the provincial program called HCAP. It's the Health Access program, and we have filled pretty well all of our home care assistant programs, both in community and where they happen to be in facility. Northern Health also funds Earn and Learn. So we are just funding the first 24 care aides to become licensed practical nurses in the Northern Lights College program in Dawson Creek. That'll graduate in 2 years. We also fund other positions that we're really short of, like CXLTs, which are combined X-ray lab techs, which is what Tumbler Ridge uses, both in their lab and their X-ray. So we see what the vacancies are being projected because of retirements and age, and maternity is a big thing up in this area, and trying to work to make sure that we're filling those positions.
Thank you, Rhonda. I know a lot of people have questions, and I think the best thing to do is that we take one at a time, and then if we have a second question, we can come back again. I just want to make sure everyone has an opportunity to speak. They're lined up right here, so yeah, thanks.
Yeah, thanks, Chris. I am going to make a question, but I'm going to ask for some clarity here. When we talk about Northern Health working with BCHS and the Ministry of Health to have 2 cars fully staffed in Tumbler Ridge, We heard from Lisa, if the car is called out, they're on a transfer. The second car is called out, it's on a transfer. I believe she said that another car would be dispatched to Tumble Ridge. Is Northern Health going to keep a pulse on that? And the reason I asked this question, it happened yesterday. 2 cars left the community, no car came into the community. The other thing I'd like to know yesterday as well on those calls, one was a code red. Did the ACP car get dispatched, or was that ACP car already busy on a call within Dawson or Fort St. John?
So that's going to be one of those things I have to go back and look at where the ACP car was, because I don't know that right now. What I can tell you is we do have a transport program in Northern Health that works directly with BCEHS so that we can ensure that as people are needing to be moved, that we're aware and we're supporting the movement of people. We see the logs that come in, we know who's waiting, and one of my colleagues works directly with that team. And so that'll be one of the things that I can get back to you on Thursday on. Because again, like I said, and I am committing to this, I will be back here Thursday. We will be continuing this conversation, and as we're starting to recruit, well, as we've been recruiting, we've been trying to recruit. The other challenge, and I know that somebody had asked me in the hallway around the practice ready assessments, the foreign trained doctors that come in. I want to talk a bit about that because we don't have the ability to take them anymore. And I think that you have to understand the reason why now.
Thanks, Lisa. So there are a number of different pathways that physicians can come into Canada if they have been gone to medical school somewhere else. The PRA pathway has been quite a successful pathway for physicians in British Columbia, and the seats in that realm have also more than doubled. In order to be eligible to have a PRA, there's 2 things that kind of need to happen. The first is that you must be able to reciprocate with a clinical field assessment, and we no longer have the capacity to do that because it needs to be a physician who's fully qualified in British Columbia. And the other challenge is that they need to be under supervision. Now that can happen remotely, possibly, but we did have applications. We did put Tumbler Ridge forward for the last 2 sessions without any applicants. And now we're so lean on the ground, it's very challenging.
I know Chris only said 1 question, but I told Chris I had
a couple.
Daryl's taken 2.
And I honestly don't want to take it away from the residents, because this is why we came here today. I mean, I get an opportunity to ask certain things with Northern Health later, hopefully. They did make a promise that we're going to be dialoguing here for the last couple of months before an announcement or the changes would be implemented. That was on Tuesday, their announcement came on Thursday. So hopefully they'll dialogue with me later. What I asked Northern Health to do, I don't need an answer now, maybe in the closing statements, we can talk about why we have a mass doctors leaving. It's not because they don't love Tumble Ridge, let me be honest with you. I've talked to the doctors, they love it here, they love the area. There's some other issues. And I think Northern Health should talk that there is some other issues that they are working on. They cannot get internally into their employees, and I don't expect them to, but I think they have a pulse on it. And we should be talking about that. You know, we have great doctors that are already here, we have great nurses, great lab, x-ray, and all the other medical professionals, as well as BC ambulance and the paramedics. 2 things I'm going to ask them both at once so I can walk away. First of all, Lisa, can we get a promise from you and a commitment that you will announce here today that this is a temporary closure of the ER department until you fully get staffed up? I ask that for one reason. I will work side by side. Dr. Helm, Northern Health, the residents of Tumble Ridge, to have doctors here. I can, I'll work my butt 2026. So I'd like you to make a promise that it's temporary. I don't like permanent. Temporary would be better. The second thing I ask is, yes, it's great that we staffed an ACP car in Dawson Creek. But that ACP car in Dawson Creek is not going to sit there and wait that we have a code red or we have a high life threatening call in Tumble Ridge to meet our ambulances or come up to assist. Can we looking at getting a rapid response vehicle, either located in Tumble Ridge from 7 p.m. till 8 a.m. or in Dawson Creek that can rapidly respond to help our paramedics? We talk about stress of doctors and nurses, life-work balance. We are going to stress our own paramedics out, having to deal with what they're going to be seeing here with no way of getting into a merge. You don't have to answer that now if you do it finally, because I'd love to hear from the great citizens of Tumble Ridge.
You have to respond to that, or you have to?
So, I can't answer both because the EHS services are not mine, but what I can do is bring the suggestion and dialogue with EHS to see what's possible. So I commit to doing that. I commit to working with my partners to see what's possible. But I don't staff ambulances, I don't staff rapid response cars, or I would have a better answer for you, because that would be something I could or could not commit to. What I commit to you on temporary versus permanent is that we are going to continue to work to staff the positions. If we have everything that we need in place and budget is not being removed from your budget, we certainly will respond to the needs of what the healthcare services are here. So it's really hard to say something is permanent when I don't know what it's going to look like. What I can tell you is the health and human resource crisis is not going to resolve quickly. And with it not resolving quickly, if I say something is temporary, in my mind that's 2 months, 4 months, 6 months. If we have doctors coming in, and Dr. Helm, you said you have people that will apply tomorrow, please have them apply to the open postings. Because our conversation would be very different here. Right now we're down to 50%. The change is necessitated by where we are right now. We also know, and we've heard, that doctors and nurses are stressed over the on-call schedules. So we would need to really address that work-life balance. That is going to be key. And when I put up the stats, 80% of people going to the ED after hours, calling people in, are calls that could be handled during daytime hours. That is the reason you can't see a doctor right now is because you are down to 50% of your physician.
When we were at 4, we couldn't get that.
The doctors are part-time. They're not
Can you guys,
full-time.
I know they're not,
If we're full-time, we don't have doctors.
but we don't choose the percentage. Remember, physicians are independent contractors. They can choose to work full-time or part-time as they wish. That is not something that we can direct or dictate.
You can incentivize it.
Carrie, are you going to tell us your story? Thank you. I don't want to give it away. Good one.
Okay.
In 2006, I had a little girl. She went to the clinic on the Friday for her scheduled appointment for her 1 week. On Sunday, she started turning blue. And thankfully, we had the medical care that we had then. We had nurses on call that determined whether a doctor was to be called in. We need to go back to that. Our wonderful doctor drove in the ambulance with her because she was not stable enough to be transported without him and a nurse. He was also smart enough to know that he was able to send us to Edmonton instead of Vancouver or Prince George because it was a shorter flight. Because of him, she is an amazing 19-year-old now. If she was here in the medical care that we have right now, she wouldn't have survived. I advocate to every parent that I have met since to have their infant CPR, to do everything that they can, because I had to breathe for my own child in the 5 minutes it took me to take her to the clinic. If I had had to wait like we have now, these amazing people here would not have had her at the visitor center, taking them out on trails, doing the things with their children, or her becoming a psychiatrist to pay back to her town. We need to recruit more nurses, go back to having nurses on standby instead of our doctors. That would take some of the weight off of them. Nurses seem to be easier to recruit and stay longer. And maybe then we could take some of the weight off of our doctors. Is that something that we can get back to?
So even when we have nurses on call, they need a physician backup. Typically they need a physician in community, similar to Dr. Helm talked about the virtual service. The virtual service requires that there's, for the most part, that there's an in-community physician in order to offer that service, because they're virtual, right? So if a patient needs to be intubated or something like that, then we need to be able to call an in-community physician
I'm not saying
for
that
that.
they can't call and wake them up in the middle of the night, but a nurse can make the decision as to whether it's a flu or a doctor needs to be called.
Yeah, there's different regulations or scope of practice for nurses in terms of, we can have some nurses that take additional training called RN certified practice, but they have a very limited number. There's only about 10 or 11, similar to pharmacists, who are able to now treat and give medications for, pink eye and urinary tract infection, those types of things, trying to spread the workload because of the physician shortage. So nurses can see some patients, but once they come to the facility, one of the largest barriers is the nurse cannot discharge that patient. That nurse has to contact a medical staff to say, this is what I'm seeing, and that's still waking the physician up.
But the nurse answered the phone from home, from her residence. She decided whether it was an emergent case enough to even go to the clinic. So if it worked in 2006, why can't it work again?
Yeah, I'm
It's
sorry, I
something
can't
to look
answer
into.
that. Thank you.
Thanks, Barbara, Dr. Hall.
Okay, so the question I have, I've inferred an answer to it for myself, and I'm pretty sure everybody here probably has inferred an answer to this question based on what's being said today. So I'm just going to read from the Minister of Health website regarding the mandate of Northern Health. So the Ministry of Health has overall responsibility for ensuring that quality, appropriate, cost-effective, and timely healthcare services are available for all people in BC. That includes Tumbler Ridge. So my question to you today is Northern Health in compliance with this mandate?
So
The answer is actually yes.
No.
And let me explain why. Okay, 2/3 of your coverage is not gone. So please, if you have another question, please get in line. 2/3 of your coverage is not gone. That's first of all.
They're in Dawson working, that's where they are.
Right here.
Okay.
After another community.
Yeah.
Taking care of our Tumbler Ridge patients.
You got a question, make sure you stand in line, because we've got people standing over there. I know you got, please feel free to stand over there, because we don't want to hold up the other questions. They're trying. I support you.
So the Ministry of Health mandate for living within an area close to an emergency room, because we have a number, and it was referenced, around people who live up in Dees Lake, people who live in other areas. The mandate is that 90% of people live within an hour to an hour and a half from an emergency room.
What about? Is that walking or by car?
By car.
Yeah, well, a lot of people here don't drive.
I understand that. I'm just telling you what the policy is. So are we in compliance with that? Because every health authority was looked at for compliance to that, and we are. So I just want to set the standard. Do you have an emergency room? Yes, you do. Is call coverage being provided at night? Not at this time because of human resource needs.
Okay, Mark?
Hi, my name's Ben Greenaway. I'm 6 years old. I take heart medication, and I gotta go to a doctor every 3 months. Why can't they increase that? So I'm not taking up time where the doctor could be doing other things. And two, why don't we have a proper helipad out here for our air ambulance so we can get people out of here? The fire trucks have to park out there. They have to block the roads down. Let's put in something there that we can get our people out. This isn't helping. What you guys are doing, it's not.
So if I want to repeat your question to make sure that I understand it correctly, because I don't want to assume. You're saying that your doctor wants you to go every 3 months to get your refill for your prescription?
Right.
Okay.
If they do it every 6 months,
Okay.
I'm taking half that pressure off of that doctor.
That's right.
There's other ways we can do this.
Okay, and so what I'm gonna do is I'm gonna ask that we take that back for consultation with the physicians. I can't tell the physicians how to practice. There may be reasons they want to see, but I do not know and should not know your healthcare needs. If there is the ability for stable and predictable conditions that are getting prescription refills, to be able to make it on a 6-month basis, I will certainly bring that back. So you'll bring it back because you have meetings with the local physicians, and I have no problem asking that question. I have chronic conditions and I receive my medication every 6 months. I have stable and predictable conditions. So that could be something that we bring up to look at perhaps opening up more appointments. So thank you for the suggestion.
Hi. On September 4th, 2025, Northern Health Communications Director Arthur Williams was quoted by Energetic City as saying that faculty diversion notifications for Tumbler Ridge was unnecessary due to the facility being just a triage center. Is it the opinion of Northern Health that Tumbler Ridge is less worthy of emergency care or communication about interruptions of emergency care?
You did a great job at asking the question. The reason why, I didn't know that was communicated. I certainly will have a conversation to ask what the intent was. Tumbler Ridge is designated as a diagnostic and treatment center. A diagnostic and treatment center diagnoses, sends out higher levels of care. I believe, and I believe remediated that, that Tumbler Ridge residents need to know what is available to them. That triage, if people are going to the hospital at night and expecting it to be open where they can get triaged, the residents of Tumbler Ridge need to know the services available. I don't disagree with you. So that is when the service interruption information started to go back out. So that has been going out. And this latest notification is a very protracted service interruption. But I agree with you. I do think that people need to know that. I'm not sure why that was said. I most certainly will look into it because I'm not in agreement with it.
Thank you.
Ready to go?
Yeah, I think everybody's aware that we're losing 2 doctors. Now, they're talking about maybe them being burnt out. But I think when they applied for this job, they would have been made aware of what services they were to provide. So I'm just wondering how much the relationship between Northern Health and the doctors itself has had an impact on these doctors leaving. And I think there's a bigger problem here than we're thinking. I think when there's a cancer, instead of the good people leaving, you get rid of the cancer. So I'm just wondering why that.
So I'm not going to comment on HR issues because I am not allowed. But I will comment on a couple of things. One, we're well aware of the concerns that have been ongoing. Professional mediation was brought in. There has been a number of attempts at reconciling differences, not only between physicians, staff, but between physicians and staff, between physicians and physicians, between staff and staff. In any place you work, there are always disagreements and challenges. What I will commit to you is that we will be looking very, very carefully at those relational issues. If a change needs to be made within the collective agreement environment, a change will be made, recognizing that we follow our collective agreement while we're doing it. I'm not allowed to talk openly about engagements that have happened. It's not fair to anyone involved in them, and people live here with you. But what I will tell you is that I am very aware of the situations that have occurred, and I will say it's not one side or another side. There is always somewhere in the middle that you find the spirit of the truth. So the excising, I think I've heard that now twice today, is definitely one way to take care of cancer. But so is systemic treatment, where you actually treat the issues and try to find common ground. That is being actively worked on.
Thanks, Charlie.
I would just like to mention, you referred to the extra ambulances that are going to be set up. There's going to be 2 here, maybe 1 in Dawson and Chapman. I'd like to tell you my experience with ambulances. I am the survivor of open heart surgery. I had 3-way bypass. I had a heart attack at 6 o'clock at night. I did not get to Dawson till midnight. That's 6 hours. If the emergency was not open, I would not be here today to tell my story because of a doctor that came in and did what he had to do. As far as the ambulances, now I'm going to explain what happened. There was no ambulance here. There was an ambulance here. My husband called 911. The ambulance could not come to our home to pick me up because the drivers had extended their working hours. So we have an ambulance, but we have no drivers. So the fire truck came. Well, we all know what the fire truck looks like. How are they going to get me, who's having a heart attack, into the fire truck? Well, can't figure that out neither. So my husband says, well, I'm putting her in my truck and I'm taking her to the hospital. So we did that. I get to the hospital, the doctor came in, that was wonderful. He did what he had to do and saved my life. Now they got to get me out. They call for an ambulance from Chetwynd. Well, Chetwynd's ambulance has gone to somewhere else to pick someone up. So no ambulance there. Oh, but an hour later, it had come back, so now it's coming to pick me up. By now it's about 9 o'clock. So anyway, the ambulance arrived about 11 o'clock. But at 10 to 11, my husband said, if that ambulance is not here in 10 minutes, I'm putting her in my truck and I'm taking her to Dawson. The doctor said, you can do that, but I'm coming with you. So I wouldn't be depending on these ambulances that are going to be all over to come for us, because they just don't. But then when the ambulance came from Chetwynd, that was great. They got me in there, the doctor was in there. We got 20 miles out of town. The ambulance blew up. Now what do we do? Well, Dawson's going to send an ambulance. So a driver by the name of Joe, apparently he flew that ambulance down there to pick me up. So I'm just saying, you can't depend on these ambulances. 6 o'clock heart attack, I got to Dawson at midnight, a plane was waiting, got me to Kelowna, open heart surgery. That's why I'm here today, for that wonderful doctor. But please don't depend on ambulances. Thank you.
Hi, I'm just wondering, is it possible to get more nurse practitioners up here to take for the smaller communities? And also, is it with, it may have been answered, but is it within their licensing to be able to discharge patients if they are in an emergency room? That way, the doctors, if they are sick or out of town, we would still have coverage.
That's a great question.
Thank you. I guess I'll just qualify by letting you know that I've been a nurse practitioner in rural BC for 20 years. And yes, a nurse practitioner has an independent scope of practice, and if they have the right training, they could certainly work in the emergency room, and they could admit and discharge to emergency room and have privileges in hospitals. There has also been the introduction of additional physician extenders, including physician assistants as well as associate physicians. We haven't had a ton of success in recruiting them. They are not independent practitioners, but if you think a nurse practitioner would help out, that would certainly be something you could advocate for.
Also, Angela, do you want to talk about the increase in nurse practitioner seats? Because this is something I think you guys need to know, because physicians are part of the solution. Nurse practitioners are used in a number of our areas, but we haven't had very many of them graduating out of BC like they had in Ontario. So I wanted you to hear from Angela what's happened with the seats for nurse practitioners in school.
Yeah, so the Ministry of Health has doubled the nurse practitioner seats, and they're the fastest growing healthcare profession in BC and Canada. And Northern Health is seeing a significant increase of nurses who go on to school for the additional 2 years to become nurse practitioners. We work really hard to keep them in their same community if that's what they want, because they typically are more senior nurses that are, may have children, may want to stay in that community versus saying, sorry, we don't have a job here for you, you have to move to Smithers or Terrace. So we are hiring nurse practitioners who are interested in coming to our communities. And like Celia mentioned, we are working to introduce nurse practitioners into emergency departments. Smithers is the first one, and we're testing that in terms of what are the additional qualifications, because that's not part of their education, is to work in an emergency department. But with additional training, there's no reason why they can't.
And we have contracts available for nurse practitioners. So if there are nurse practitioners that want to come here and work in the town, I'd work with the Division of Family Practice through the Primary Care Network Plan and look at opening up a position for a nurse practitioner. I have no problem with that. All of these are options and opportunities. It is not that we do not want to hire. It is that we have open positions that people are not applying into yet. However, there's some reasons, some of them mentioned today, that are structural, that are functional, and that are relational. And we will work at addressing those. The addressing is a two-way street, and there has to be willingness on both sides. But if there's a nurse practitioner, or if one of you is a nurse that wants to become a nurse practitioner, if you have children who are thinking of healthcare, have them get in touch with us, because we know the programs that are available. We can help connect them with the scholarships that are available. I only have 2 kids. Both my boys are in healthcare. One wants to be a rural emergency physician. He's applying to medical school in 2 years. He's just finishing up undergrad. So I know it'll be some more time, but you know what? That's what we have to do. Like, I actually had to pull to get my kids to really think about it. I see kids in here. Are you interested? Let us help you. We have building block programs that allow you not to leave the community or leave for short periods of time. Angela talked about HCAP. HCAP turning into LPNs. LPN access to RN. Are you interested in being a physician? They have great programs to bring people in from rural. Us bringing people in and recruiting from outside is not nearly as successful at retaining people in community as growing your own. So that I'm interested in looking at how we do together, because that keeps people here. They have their family here, they have their connections here, they know people here, they're part of the community.
I'm just wondering how Bill 36, passed November 24th, 2022, has affected the health policies and programs in BC. Bill 36, I don't know if anyone remembers this postcard that went around for everyone being told that healthcare was at risk. Over 10,000 individuals voiced concerns by signing the petition and urging British Columbia government to halt an overhaul of the healthcare system. November 24th, 2022, it went through, and MLA made a motion to dispose the debate, and the motion was carried. So public was denied due democratic process at that time, and this was put through. So I'm just wondering, you can go on government websites, the restrictions now in place, there's a list of 9, I'm not going to read through all of them, but I'm wondering if that has affected some of the downturn in BC.
So that is an excellent question. I have people taking it down. I am going to go back because I don't know the answer to that. But I will look, I will try to understand, and I will seek the answer for you.
Mark? Oh, you'd like a 10-minute break? Okay.
If possible.
Can we have one more question? Thank you. Let's amp it up. Here we go, Mark.
promised my wife I wouldn't speak again. I'm angry, but I'm polite, and I'm scared, but I'm calm. I just need a point of clarification before I ask my question. I listened to your presentation, and from what I can understand, you're not actually suggesting that of the two options, the second one is the best. The first option being see a doctor, take an ambulance ride, see a doctor in Dawson. The second one being take an ambulance ride, see a doctor. It must be better to see a doctor, then take an ambulance ride, then see a doctor. You're not suggesting that that's the better option for patient care. You're suggesting that if we had the doctors, we would have the doctor, the ambulance, and then the doctor. Is that correct?
So,
And then I have the question. I just need that clarification.
so there is a two-part question to that. Do I think taking an ambulance to where you're going to get the best treatment for what you have is important? I do. I actually think that if it were me, I wouldn't want to delay. I wouldn't want to wait 6 hours. And so for that, I want people who have critical care concerns to go to a hospital that can treat critical care concerns.
On the other hand, I would rather be in a room with Dr. Helm before I take that ambulance. To my point, the problem is recruitment of physicians from what I'm hearing. I'm the science teacher. I've been your science teacher for 20 years. The number one reason I hear from my students why they don't want to become a doctor is the cost to go to med school. My own son is planning to become a doctor, but he's terrified of the cost of med school. And I'm trying to talk to him to come back here as well, just as you are with your son. In the military, which I grew up in, we would sign up officers. We will pay for your university for 4 years, and you serve for us for 5. Why can we not do that for physicians? Get a contract, say, we will pay your medical school, but you serve this community full-time for the next 5 years or 10 years. We could do that right now. We could go to students who are coming out of med school. They might not be the most experienced, but that's better than not having anybody. We could literally walk up to them right now and offer them that money and say, you sign this contract, we'll take you on. And they will not find a more appreciative population than in Tuttle Ridge. Agreed?
Can we do it? I don't know. I'm not sure.
Why have we
But we can certainly ask the question. I know that there are quite a few incentives for physicians, for forgiveness of tuition. Do you want to go over what some of them are? Because I do not know all of them. I know most of them for nurses, although Angela would know most
But my
better.
question wasn't about incentives. My question is about a contract, a legal binding contract that says, we'll pay this, you must serve. And if you don't serve up your 5 years, you don't
pay
practice.
half.
No, you don't practice medicine in Canada.
Oh,
Or
I
something to that effect.
don't know that we could do that,
Well,
nor do
we
I.
have to have teeth in it. Or pay back the loan, whatever. Or pay back the loan.
So
yeah, I guess.
we do have that for PRAs where they have to give a 3-year return of service to come. And if they don't do the 3-year return of service, they have to, as you suggested, pay it back. I don't know if we would, well, I wouldn't recommend taking anybody's MD license away from them at this point because.
But if that's working for the PRAs, can we do it for physicians?
So the PRA program is quite different, and they have a return of service through the province of British Columbia and then through us. Having said that, if they chose to leave and go back to another country, it would be very unlikely we would be able to recoup those funds, right? So, our return of services agreements are great, but I don't think there's a blanket, we'll pay your education, you could do that. I'm not saying that that's not something you might bring forward or we could bring forward, but I don't know that it would be a super great recruitment. Maybe.
I have a number of high school graduates.
Our communities to go to these schools. Talk about our own states, not every country.
So Northern Health has asked that we take a 10-minute break so they can get a moment. Dr. Helm does have something he'd like to say while Northern Health takes a break. It's not a question, just some comments. You have some comments? Yeah, thank you.
Yeah, so I know we need to take a break, but I also see some people leaving. So I think it's important just that we take a minute and assess what's been happening here. I think they've been really, really good questions, really good. And I'm really hoping that the Northern Health contingent is going to listen, not just say, yes, we hear your pain, but listen. There's an art to listening and actually absorbing what has been said. And I also want to commend the audience here. We're angry, we're frustrated, but I want to commend everybody for the really constructive way in which you discussed this. So I've listened to the presentation from Northern Health. There are some things I fully understand. There are other things I definitely disagree with vehemently, can I say. I guess I can acknowledge the courage of our Northern Health representatives. It takes courage to come to a community and tell them that losing after hours care is actually to their advantage. It's very good. But I really hope that the idea of collaborating, and as an example, the Primary Care Network, Kendra Kiss and I co-chair it. We were blindsided. I was blindsided. The Division of Family Practice got called 20 minutes before the announcement went out. We got called because people know we have an interest in this, but we were not involved. Now, these are the things that Northern Health, I really think, can listen to and can take home. I'm also scared whenever I hear Northern Health people say, you've got to be at death's door before you call 911, which is essentially what we've heard. The problem is that you folks, how do you know if you're having a true emergency or not? You don't know. So, absolutely, some of these things might turn out to be, well, you didn't need to be seen, but how did you know that? You didn't. You came because you thought you might be having a life-saving emergency. You are not there to abuse the system, you are there to look after yourself. So I'm always scared, because I think that's a dangerous line when we tell people, no, only come in when you're really having terrible chest pain, or you can't breathe, or you're going blue, or whatever. And what I don't like also is, what I'm hearing here is just we're mixing this idea of the golden hour. I was trained on the golden hour. That's when I, as a physician, could help you folks survive, stabilize you, get you to where you need to be. I always wish we had hospital beds in Tumbler Ridge. Yes, I know we're a DMT center. As long as nobody's being bored. We're the biggest DMT center and the most remote, I think, in British Columbia. I think we still are. But the mayor, our first speaker, and I have come with a consistent message to Northern Health. And I know it's sort of been acknowledged that, yes, the recruiting is carrying on, and if numbers come back up, yeah, we can look at it. I need that in writing. I need a new announcement to go out, acknowledging the misunderstandings that arose from the first announcement. My problem, I've been here before, and I might be very inconvenient for people today, but I remember what it was like, and I know the battles that I fought before for this community. And I know how things go wrong. And how things go wrong is when there is an announcement like this that is ambivalent, and you can make what you want of it. You can say it's temporary, you can say it's permanent. You just don't know. We need to hold people to the fire. Is that the term? Yeah.
Hold their feet to the fire.
Hold their feet to the fire. Exactly.
Either that or burn the witch.
That's what we need to do. We need this in writing, so that forever after, when we get those numbers up, which we will do, I promise you, we will make it happen. Tomorrow I'm having a debriefing with the Division of Family Practice, with the Primary Care Network. I'm telling people these are the things we need to be doing immediately. We were not consulted, but here it is, it's happening. We will succeed here, but we need to know that when we succeed, Northern Health will heed this and will restore services as soon as we've done that.
Yes.
We need that in writing. So, my closing comment is that now we have some ideas. We have a way ahead. We have a path forward. But my goodness, this should have been happening weeks ago, months ago. Not today like this. Thank you.
I was bleeding profusely, in terrible pain, and Grandma had to stay home because I've got other kids at home, right? And I can't drive at night. So you've got these two, my elderly husband, my young granddaughter. They're in Dawson Creek. So what are you going to do with them? I can't drive at night.
So what are we going to do with them insofar as getting them back?
Yes.
Yeah, that is a great question, and it was one of the questions that I asked, because we know that ambulance service is one way. And so one of the things that we have available is a transport system. I know Aaron isn't here right now, but what I hope you are. So what we need to do is get the information, because we do have an ability to transport people from Dawson back. We also have, and so that is separate. It's an existing service. I will make sure on Thursday that I bring the material, because I think people may not know about that, because I got a lot of questions that had come in specific to that. In addition, we're looking at expanding Northern Health Connections, which is our bus service that goes between facilities. With the care being provided in different areas at different levels, we need to do more and better with moving people. But I will make sure that we have the material available when people come visit on Thursday. We'll also keep it at the health center so that you have it available to you.
A bus would not have made a difference. This is at midnight, 11:30.
11:30, she was finished being stitched up. There's no bus in Northern Health that's going to come at 9:30 to the hospital, 11:30 to the hospital. And what transport system is this that none of us have ever heard of?
So the existing service is called TR Cares. I don't know if anyone is familiar with that. Excellent. No, at this time, I fully understand what the schedule is, but it is in partnership with Northern Health Connections, which is, you might have seen the larger coaches traveling on highways around the region.
They also don't allow children to travel to your town.
I just noted that actually in the information. So Northern Health Connections is looking at expanding to the options that are available in this area. And so I will get that information for Thursday for you.
One more.
So in reality, there isn't a system, because TR Cares does not travel at night, doesn't take children on the road.
One, our military doctors are trained, but BC Medical doesn't recognize them because they're not certified enough. I think we should help them out.
Thank you. I would say, unfortunately, that falls with the College of Physicians and Surgeons in BC, so they do all of the licensing in BC, and it's certainly nothing within our ability to influence. And so that could be, a group that you might want to send a letter to, but we don't actually get to license nurses, doctors, midwives.
Okay, and the second one is, maybe you guys should do an 11:30 on Christmas Eve ambulance call here in Tumbler, and with no doctor here, and him putting an IV in your arm, driving down that highway that is horrible, and that's where you're putting our lives in? Like, I think you guys should try a dry run and see how this really works.
My name is Debbie, and I've lived here for 25 years. Most everybody knows my face. And I know we're concerned about the ER. That's the main issue today. But part of the problem is that we can't get regular doctor's appointments during regular business hours.
Yes.
I am like them. I have to get regular prescription refills every 3 months. I called mid-August because my prescription runs out mid-September. I couldn't get an appointment because the schedule wasn't fixed yet.
Yeah, that's scheduled.
Now we're into September. They're booking appointments in November. What is going on with that? And also, I have been seeing the same doctor, my family doctor, which is a misnomer because they don't look after the family. I had to make an appointment for a meet and greet. My children that I still have at home can't be looked after by the same doctor until they get a meet and greet.
And approve of it.
And that is all on Northern Health. That's what I'm told anyway. If the doctors didn't have to make those meet and greet appointments, they would be free to do regular appointments.
That's right.
Thank you. I can only imagine how frustrating things are. I don't know how much influence the individual providers have over the schedule, but I did hear Lisa say earlier that we were going to have a look at, kind of how we can increase access. I think that's something that can be done. But individual physicians will make decisions about your prescription length, but I can raise that to them as well.
That's not really the issue. The issue is being able to make an appointment and being told, no, you can't,
Schedule's not there yet.
because the schedule's not there. And being told that my children have to do a walk-in because they haven't had a meet and greet yet. That means they have to lose a day of school on the off chance that they might get to see a doctor for a regular appointment.
Thanks, Debbie. Amy?
I have a child with a long list of life-threatening food allergies. She carries EpiPens. I was wondering what amount of medication, life-saving medications, are on the ambulance that the paramedics are actually allowed to administer, because EpiPens are only a stopgap, and of course that's if there's an ambulance available. If they're not sending one from Dawson because in full-blown anaphylaxis, why bother at that point? But I want to know what epinephrine, steroids, and other life-saving medications, and I know anaphylaxis isn't the only one, TPA, anything that the paramedics are allowed to administer, because often we have an RN or a physician escort. So by removing the weekend and evenings, moving those shifts, we have also lost the RN and physician escorts who are able to administer those medications while on the dangerous icy road through the winter. I would really like to see the stats on how many RN and physician transports happen and how many we have had removed by this decision.
So what we will do is bring the list of what can be administered, because I don't have the answer to that question. I could tell you certified nursing practice, what they're able to do, but I cannot speak to our paramedics. But I will bring that on Thursday. Please come and I will have that for you. And insofar as the number of nursing and physician escorts, I do have those statistics, so I will be able to bring them as well.
Barbara, we're next. Michael?
Okay, Max?
Maybe Max hopefully stays quiet for a little bit.
He's adorable.
Thank you. So firstly, my main concern is I've never been on a 911 call where the patient didn't think that they needed emergency care. I think Dr. Helm articulated that beautifully, but that was my main concern through this whole thing. I think it's honestly terrifying and possibly even a little bit reckless that the attitude coming from a trustable healthcare provider is suggesting that the solution is that patients effectively self-diagnose. I find that terrifying. And secondly, from what I can kind of tell here, it seems that the largest problem is the difficulty in recruitment. I think that's kind of the overriding message from today. And I think sort of the second layer of that is it seems that a lot of that causation is because of the additional stress that we're placing on the physicians for providing after-hours support in the first place, while also being expected to respond and be on call during the regular day. Now, when we first started the presentation, you outlined that the money and budgets were not changing, and that was not in contention. And the question I have is why? To me, and maybe this just seems silly, but if the main problem is that we're expecting people to work both daytime and nighttime, surely the actual solution is that the budget should be increased to provide proper staffing and support for patients.
Thank you. So the physicians in Tumbler Ridge work under an alternate payment model contract, which is part of the physician master agreement, which is through the Doctors of BC and the Ministry of Health and the health authorities who negotiate that, so it's quite standard. So physicians are, within their contract, there is some specific deliverables in terms of the number of hours. If they're on call, there's, an after-hour call, but it doesn't kind of delineate like that you have X amount of hours that you spend doing this and X amount of hours doing that, right? So we are somewhat limited by the physician master agreement, so the idea of paying more on a provincial-wide agreement would be really difficult. Having said that,
yeah, but you referenced the comment I made around not changing the budget.
That's right.
Because the physicians are paid on an agreement with the province. The budget that I'm not changing is the one for the nursing and allied care. We will be increasing our component of nursing and allied during the day and not losing any of the budget. We're not doing cuts, layoffs, anything like that. So those continue to be in place. But on the master physician agreement, that's something that the province negotiates with Doctors of BC and HEABC collectively.
Are we talking on an individual level to physicians, or are we talking basically being able to recruit more physicians?
So I've not had the experience ever in my career, and I'm probably around the same vintage as your esteemed physician. So I've been in healthcare this long, and we've never, ever not found a way to pay a physician to come into a community, ever, in my experience. Ever. So from that perspective, I think that there's an underlying context here. And I want to address it, and there he is. Okay, so we're about the same vintage. The way I work and the way you work are likely very similar, or worked prior. That is not the same context of how people work today. We are butting up against that, not just in healthcare, but in all kinds of industries. Yes. And my God, I hope I train my boys better than this. I really do. Because for me, healthcare is a service. I am in service to you. He was in service to you. She has been in service longer than me to you. How we are in service is different today. I don't know how to change a generational difference. For every one of us, you need at least two.
Yep. Yes.
I can't I want to change that. I don't know that I will be successful in changing that. In fact, I know I won't. So for every one of him, and honestly, we probably need 6. That's our reality. And my hat is off to you. The care that you provided this community, I wish I lived here. I really do. Because I would have loved to have been here to have you as my doctor, as my late husband's doctor. So I want to acknowledge what we haven't acknowledged. The elephant in the room here is health and human resource crisis aside. We need exponentially more to do what was done before. And that goes to your question about contracts, and it goes to your question of, do we need double? The answer sadly is yes. Yet we have less than half of what we need.
Mark?
Oh, I'm sorry. That's okay. Okay, I'll give this a go. I'm not good at this. I've lived in this community 25 years. I've lost a husband, a father, a child. With all good services, they kept them alive as long as they did. But now, I'm here, I've been on disability most of my life. I've got grandma epilepsy. I could be forever listing off everything that's wrong with me, not counting the ADHD or the autism or anything else that goes with it, or the panic attacks. I was lucky enough to have a good doctor before, and he dealt well with my panic attacks, and he talked to me and got me going where I needed to be. But putting doctors aside, am I supposed to move to Tumbler Ridge or out of Tumbler Ridge? Because now I've got nobody to help me. I don't drive. I can't be taking an ambulance every time I've got a panic attack going on. And when you're in panic mode, you don't think of, oh, I can call 811 or I could call this person. You don't think of that when you're having a panic attack. I mean, I'm lucky enough, because I also look after my grandchildren, that I keep them in mind when I have a panic attack. So who's going to be here to help me? Because I can't be taking an ambulance. I spend 95% of my life in Dawson Creek, and nobody will be here for my husband or my kids. So what do I get to do?
So it's an excellent question. It really is. And panic disorder is not easy to live with. And I am sorry for your losses. Having just experienced a recent one, I can't imagine all of the losses that you listed.
I'm not worried about the losses. They were well taken care of.
I know, but you're worried about yourself. You're worried about the kids.
We gotta be worried about all our children. I won't call in 911 because I'm having a panic attack. Because there's somebody else there could be losing an arm. I won't get in that ambulance to take their place.
But she still deserves adequate health care.
Absolutely. And so if you want to come on Thursday, I'd like to go over with you some options.
Telling me what there's out there, every person or everybody I know knows what's out there. We've lived here for 20 years. We know what we have. We also know what we're losing. And I
Thank you.
Kelsey? Laura, come on down.
Hi, my name is Chelsea, and like everybody else, this is my home. I actually just moved back in May, my family of 5, but I grew up here. I was a frequent flyer of Dr. Helm and Nurse Barr, spent many nights in the emergency room while my mom slept in the car because it was routine. I was there all the time. I have compromised lungs because of Dr. Helm. We found out my dad had compromised lungs. His whole family, we have multiple double lung transplants running in my family. because of them, I got 15 more years with my dad. We can't not have an emergency room. Like, I would have died, never mind my dad. We know that, it's public knowledge that recruitment is the issue. And we also know that recruitment in the north, in every industry, is an issue. What is being done above normal recruitment levels for the north? Because we need more than what you're offering down in Vancouver or down in Prince George. We need more than the average recruitment in anything, not just healthcare.
Thank you for the question. Yeah, I completely acknowledge what you say is true, and it does feel a little bit like we've lost our rural advantage in our ability to recruit. So I can tell you that our medical affairs department is working tirelessly to raise these issues at the ministry and at the provincial levels, and we are working hard to recruit both within BC. We've had quite a bit of success recruiting some US physicians. We do everything we can. We go to conferences, we have postings, we do things. And even though it's our responsibility, I would say that, there are communities who also contribute to that, and they have site visits, and they have a liaison member, and they provide these things to help us out. I mean, we can recruit to positions, but if we're recruiting to the community, we really need the community's help as well.
You saying there's no community help? She said that. So do you know what the council and the mayor of Tunbridge do on behalf of recruitment for Northern Health?
I do a little
Okay.
bit, yeah. Thank you. Beyond the
We
council.
do tons.
Yeah, I know you
We do tons. So just a comment, like you're saying how you need help with recruitment. I'm not to argue, but like we do a ton. We roll out the red carpet. We do dinners. We do riverboat trips, helicopter trips. Take all medical professionals out for dinner.
I know.
So I just want to make sure the residents know because we use their tax dollars.
They do know.
We know where everybody stands in town. Northern Health needs to acknowledge that.
Okay, next up, Crystal. Good question.
So you guys, we're gonna do an extra 10 minutes to 1:15. We will restart on Thursday. So I just want to frame that because.
How about you come on another weekend when more people don't work Monday to Friday? Or the other people that work shift work can come, because a lot of people can't come on Thursday to find out all these other answers. I have to work, I can't take the day off to come see. You guys say, oh, these are the answers. Here's our PowerPoint.
So we will look at having another weekend day available where we can be here as well. We haven't announced any dates past next week, but we will.
Crystal, your question?
So my question isn't about recruitment, it's about retainment. Because it seems like we do have a lot of really great doctors that come to Tumbler Ridge, but for whatever reason, our ability to keep them here, we haven't been able to do that successfully in quite a few years. So I'm wondering if there's a plan for retention for doctors that are coming to Tumbler Ridge.
First of all, I just want to apologize. I know Tumbler Ridge does a ton. I know South Peace Divisions of Family Practice does a ton. I also think we need to do some brainstorming about what could be successful, right? So I know you do make physicians and others feel welcome in your community, and that's a bonus. Not sure what the big barrier is right now. In terms of retention, we're on a contracted model. Some of the newer physicians come in, some of them want to go to a big city after they do a 3-year contract. So, I mean, retention is about that work-life balance that we see people want, and trying to make their work life as good as possible. So I think it's ongoing work that we have to do.
So I just want to give you a comparison because you asked a great question. In rural, the scope of rural medicine is far broader than it is in, say, Vancouver, where you can work on the licensed family practice model, have a panel of, I'm going to say 1,500, it's 12 to 1,500 people, work 9 to 5, Monday through Friday, or 8 to 4, and that compensation model is the same as it is here.
No call,
No call, there's no emergency, there's no additional types of medicine that need to be provided. So there is a small rural retention incentive, thank you. Sorry, I don't speak doctor really well, but I am trying here because I know that's our challenge. But it is 12 point.
It depends on the,
Increase it.
so the joint standing committee and others define these, and it does depend on the community. So the smaller, more rural communities can get up to like 25 to 30%. So that's on top of those things. There are other incentives are like, flat fee, those are more the recruitment. It's probably not enough, and it's not up to us. We don't get to set that. That's part of the PMA
And it goes to the work-life balance. So this is multifactorial. It's not just how much we pay, because with the LFP model, physicians have increased their financial remuneration far more than you would have had in a fee-for-service model. And we're still having difficulty attracting. And in rural, it's worse. It's worse because we expect more. We have to have people who are going to see emergencies. We have to have people who are available far beyond an 8 to 4 schedule. And so you remember when I was saying how it takes 6 to replace him? There are quite a few reasons why this happened. And we're just unpacking a lot of them. There is a lot of work that has to go into this. It is far beyond the scope of the 3 people you have here. But these 3 people will keep coming back. We will keep advocating for that, but I don't disagree with you. What are we doing for recruitment? We're using every tool in the toolbox that we have, and we still need more tools.
Okay, we have a lot of people with some questions, so hopefully our presenters can keep their answers brief so we can get through a few more. Thank you. Lynn?
My question, I had a few people ask me, when are you coming back on Thursday? What time and where?
We'll be at the health center at 12 o'clock.
What room?
Just come to the front door.
Just come to the front door and we'll have someone bring you in. We'll figure it out. So then maybe we sit outside together. I'm not allergic to outside.
Okay, let's, Becky, you have a question? Kim, we have 6 people waiting in line.
Just one more. My question is this, maybe I'm stupid, but I haven't heard a definite answer. Will the operating emergency room open again when we get the physicians?
So there isn't a one word to this. I have to.
Somebody walked in tomorrow with 4 doctors that would work here, but our operations open again.
A lot of it will depend on what the physicians are able to work and if we're able to retain them in the current model of care. You just heard me explain, I know you did, that it is beyond just money. People are telling us it's not about the money, it's about the work-life balance. And that is where the challenge is. So if we have people that wish to work in a model, we will work with them for that provision of care. But I can't answer that because I don't know who the physicians are and what they are willing to do. Remember, they are independent practitioners. We have to negotiate with them what they're able and willing to do.
Rephrase. If they brought in more people that were willing to work exactly the way your contract says, would our ER open up again?
Thank you, friends. We only have a few minutes. We have a lot of people in line, so let's try and get through a few of these questions. Thank you.
Whatever it is, Andy.
Thank you for coming. I guess I'm going to speak with tourism. We have people in Tumbler that work directly to bring people into Tumbler Ridge. One of your own, Bailey, she posted just a couple hours before you guys announced on Facebook, Canuso Falls, beautiful place. What, 4 hours later? Oh wait, don't come after 7 p.m. because we don't have emergency services.
Yeah.
So, kind of interesting that way.
Well said.
Part of the minor hockey board, we have several teams that we are trying to bring in, provincials, whatever. How can we sell, but we only have 2 ambulances, so pick what players and what potential residents in that 48 hours are going to get to be able to utilize those 2 ambulances. So I guess my question is, who decides how many ambulances Tumbler Ridge gets, and does it change when we have more people come into town?
So being in your area of work, you'll know that for any of those events, there's a requirement on the event organizers to plan for healthcare services.
Absolutely.
So part of the work that your team does will be looking at what medical care is required. If additional supports are needed from either health or EHS, it's incumbent on your organization to allow us to know that so we can work together in the planning.
Who do we contact for that?
So you would talk to Becky and Kendra, and they would know what we have and then who to contact if additional supports are needed.
Hi, I'm here to advocate for my daughter who was diagnosed with kidney disease at 2 years old and ended up with a kidney transplant 2 years ago. It is required with BC transplant that if she has a fever for over 48 hours, she is to be seen by a practitioner. Now, without emergency services, I'm going to have to call 911 and go to Dawson Creek. Are they pediatrically trained, or am I going to be waiting even more time to be ambulanced to Prince George, Vancouver, or any other area?
So you can still come to emergency here, and if you have a 48-hour... So if you need to get care in a 48-hour period, then my advice would be to seek services here if you're able to. If you need to go to Dawson Creek, they absolutely would be able to see a pediatric patient.
Because in my experience, when we went to Dawson Creek, we were again brought to Vancouver or Prince George, and it's not that we're there for a day or two. It's 7 to 10 days or even longer.
Unless it's changed recently, there wasn't a direction in Dawson Creek.
There is not. The closest is Prince George. There's one in Fort St. John as well, but he's overlooked.
That is true.
Sorry.
So we unfortunately, in a system, we all work in a system, and we aren't able to provide every service in every community, just like we don't have a surgeon here. We do have some visiting pediatric specialists in Dawson Creek, but that doesn't meet your emergency needs. Having said that, Prince George is really the only facility in Northern Health that should be admitting kids that are sick. And of course, we partner very closely with BC Children's Hospital for children who need that higher level of care, where they have all of the specialists that a child might
So that's what
need.
I'm asking, is the ambulance able to take us to Prince George rather than overwhelming your emergency in Dawson Creek, seeing her for 2 minutes and then waiting to be transferred? Or do they automatically just take a pediatric patient to Prince George?
I think that that has to be a conversation between provider to provider, right? So, you know, it's up to a physician to call another physician or specialist to arrange specialized care.
David? Hi, thanks again for talking with us. My question is, we know that both Dawson Creek and Chetwynd are regularly on divergence. So what happens if, in the time period when we have an emergency here, we're then sent to Dawson, and now, because our overflow is now going to them, their doctors are now stressed out, they're having the same problem. Now we're sent to Fort St. John or Prince George or wherever. What is being done to prevent this just cascading through the rest of Northern Health, basically?
Yep.
So we work very hard in the Northeast to look at our services. We recognize we are challenged, not just in Tumbler Ridge, but in Chetwynd and in Dawson Creek and in Fort St. John, Fort Nelson. We meet every noon hour to look at the schedule, to look at nursing staffing, whether or not we have an OR open, anesthesia, in which community, so that we can try to prevent dual closures in a corridor. So we are looking at it every week and doing our very best to coordinate care and if necessary, to elevate things up to BC Emergency Health Services so that everybody is aware.
Mary Jane?
I almost left today because I didn't think I was going to have an impact here. But I realized I was so angry I had to come back. You talk about the number of people who come into emergency that don't need to. They're not real emergencies. Well, let me take a window off of one of those patients for you. It was after supper when he started having real tightness in his chest. And we were concerned, but we talked about it. And we said, you know what, we're just going to take it really easy tonight, and we'll go in the morning. But as the night progressed, he had more and more difficulty, and he was strangling, he was struggling so hard to breathe. So I called the emergency, and I had the ambulance come. Well, gosh darn it, he wasn't having trouble at all. Because they took his O2 level, and it was 93, and apparently 94 or 95 is ideal, so there was nothing wrong with him. But the man couldn't breathe. He was gasping. So they took him into emergency, and a doctor saw him. Now, I understand the doctor couldn't make a whole lot of difference, but let me tell you, being able to see a doctor that night, and at least have a qualified opinion that we weren't going to be able to do anything that night, at least gave us the peace to go home and try to struggle through the night before we could get in. What would we have done if we couldn't have gotten in? That's my question. Because under the standards you're saying, we wouldn't have gotten that doctor's opinion. We would have had the ambulance who just said, looks good to us, it's good numbers.
Okay.
Hi, I'm very nervous. I know there's been a lot of talk about recruitment and how it's hard to get doctors and their work-life balance, and I completely understand that. I can't imagine doing that job. However, my question is, because you've been unable to answer whether it's temporary or permanent, when doctors are being hired to come here, is it being a discussion that it is the hopes to open up the after hours and not just, we were looking for a doctor 8 to 5, because I could see doctors going, yeah, absolutely, that sounds great, but that is not ideal. That I really hope you're looking for doctors who are coming in hopes to open that.
I can actually answer that, or do you want to?
You go ahead.
Okay. You've had a lot of... So we're looking for full scope positions here across the board, which includes emergency services. So we are not saying we just want family practice physicians to come in without full scope, without emergency practice. We're looking for the whole kit and caboodle. That will not change.
That answers my question. Thank you.
Hi, I'm Dan Calloway. I'm a mine manager for Human Resources. I'm not here speaking for the company. I'm a TR resident though for the last 15, 20 years, I think. So, just within Canuma, we have over 1,000 employees. And as a mine manager, I'm responsible for all of them, right? And this is going to severely impact us as a company by not having after hours emergency care. By having employees have to be transported and often on times on diversion, especially on the Chetwynd right now, it's very concerning for myself as a mine manager for the safety of all of our employees, not to mention all the residents of this town. I would hope that you guys could say this is temporary, not permanent, because it's very bad. We will have to relook at our procedures too, just as a company regarding this. This is going to possibly put more stress on STARS, Bailey helicopters for responses, just to our company. This is just me speaking, not for the company. Minor hockey, I'm a minor hockey coach out here, same as Becky. Very concerned. We have practices that run after the times that the ER will be closed down. We have taken kids off. We try to do everything as safe as we can, but things happen, as in any activity, that we have taken kids off in stretchers. They were okay afterwards, thank God, but that's a concern by not having physicians here as well to deal with that. As Becky said, we have tournaments every single weekend, games all the time. I don't think you can probably assess the long-term impacts of this decision either. People are going to move away from TR. Like, hands down. So, you know, the elderly in town, they come with also other generations that are supporting them here. If they don't have the care, they're also going to move. We're going to see a reduction in our residents of Palmer Ridge. A little fact here for everyone. The President and CEO of Northern Health received a 5% increase in pay based on performance. This was in 2023. Also an 8% increase, in 2024. And this raised the wage for the President from $356,000 a year to $456,000 a year. The top 5 positions in Northern Health are all above $300,000 a year. To me, it doesn't seem like a bonus based on performance should be handed out if Northern Health can't keep staffing in TR. And the last question I actually have with this, in your opinion, do we need an increase in the budget amount of doctors for the area so they aren't on call, or a promise to review the amount of doctors needed if we get full staffing?
Thank you. Again, I just want to emphasize that the Physician Master Agreement is negotiated between the Doctors BC and the Ministry of Health and HABC, so we don't have a lot of influence in that, right? When we can be fully recruited back to 4, if we determine that maybe we need more, we need to go to the ministry and ask for more, right? We don't just kind of have carte blanche, but we are recruiting. And we have 2 postings now, and you know, we try to...
Chandler Ridge?
Yes. Yes.
Can there be a review of more doctors so they're not on call getting stressed out and routine?
Well, we can certainly look at that. We've tried to be flexible, allowing them part-time designation to keep them as opposed to full-time designation. That doesn't mean we still can't recruit to 4.0 FTE, right? So if we have 2.5s, we still have 3 FTEs available. So I think what we need to do is go away and look at a number of different things, and you know, I really hope we can recruit back up to our 4.0, and then we can really revisit with them what are their needs, how is the call line, what can we do to support them.
We actually do have to leave.
I'm sorry. That line got a little bit longer, guys, so I do have to close this off. This will have to be the last question that we take.
Mayor, here we go.
You should be a doctor. You can close it off.
Yeah, we'll do
Yeah.
it. So you've heard numerous stories today. These represent only a fraction of the stories in Tumblr, right? There's a lot. Long term. Okay, I'll start over.
Like
So-
an ice cream cone.
Yes. thank
That's
you.
how I remember.
So there's been numerous stories today, and these represent a fraction in Tumblr Ridge over the many, many years and decades that people have been here. The current plan is not going to work for the community of Tumblr Ridge. We need a different plan. Northern Health has created fear and uncertainty with the messaging that was disseminated this week. It was inappropriate and unfortunate. The community feels at risk, okay, and we need to do something about that collaboratively. And we're looking to you as leaders to help with that. You're here today as leaders. You are decision makers. We need you to come up with a plan for this community from today to 24-hour medical service for the community. Okay? The plan, you set objectives, that's your jobs. You can set these objectives, you can set the goal. The goal needs to be 24-hour medical services for the community of Tumblr.
Thank you. So, Mayor and I, Dr. Helm, we're going to stick around. If people want to stick around, we can have our own discussions about, we can tell stories, hear each other, and talk about what we can continue to do. So thank you, Northern Health, for coming out and giving us 2.5 hours to talk about this issue, and we'll see you again Thursday.